This conference will now be recorded. This conference will now be recorded.
All right, so just to recap there, so I mentioned to you about regarding melanoma and retinoblastoma, so cancer of the retina. So going on to regular eye checks by an optometrist or an ophthalmologist is really important, okay? To make sure that they can not only just check to make sure that you're seeing clearly and not having any type of blurred vision, but also for other types of eye pathologies like glaucoma, which would be increased pressure within your eye, as well as we're looking at here these different cancers. And to really be able to view the retina, the doctor has to look into your eye there, right? It just can't just look without any type of unaided type of instrumentation. So really important to have that taken a look at and be examined every 2 years minimally. Cataracts. The next slide here. So cataracts, this is an issue with the lens, and the lens becomes cloudy. Instead of nice and clear, that lens becomes cloudy, and it's usually over time. Although, again, too, people who have a genetic predisposition towards this, it may happen sooner than later, as far as earlier in their life than when they're hitting their years like after 60 or so. You'll see here that this cloudiness of the lens can scatter those light rays. So here, think about this for a moment, right? So when we see light is bouncing off of whatever images that are around us, and it bounces back and hits our eyes, passes through the cornea, through the lens, right through the pupil, through the lens, and back into the retina. Now, if it's cloudy, that can be a problem. That can scatter the light rays, and it can really, look at this here. It says if the lens becomes totally opaque, no light can enter the eye, right? So that's a major problem. So they can do surgeries in order to remove that. Now, if someone needs a new lens, right, or a new cornea, they don't have to go on rejection type of medication, right, because they're clear. They're clear, so there's no blood vessels in those structures, so they can receive an implant, right, a transplant, and it's not going to be a problem for that their body would reject that. Understood? So cataracts, the lens, and then we can also have corneal transplants. And I said to you about the astigmatism, issues with the shape of the cornea, that can be a problem. Now, this term macular degeneration. So when we think of the macula, this is an area of the eye where there is cones and rods. Remember those photoreceptors? Cones for color vision, rods for dim light, night vision, okay? The fovea is the bullseye of this area called the macula, and the fovea only has cones. It only has these cones that are for color vision and sharp vision. So look at here, it says macular degeneration. So your ability to be able to focus on something, right? So whatever it is, so how about everybody in the room here, wherever you're sitting, look across the room and focus on something. Focus on something. I don't care what it is. Those of you online, focus on something that's in the room that you're in. And imagine then, if you had macular degeneration, whatever you're looking at, the central area where you're looking at is going to be all blurred out. That's somebody who has macular degeneration. That's what's going on with their field of vision, their ability to see. So let's look here at this next image here, the PowerPoint. And so you'll see here that folks that have issues with diabetes can have an issue with their retina and bleeds within their retina that can cause defects like this on the upper left-hand corner. Cataracts, we said what? Cataracts are a cloudiness of the lens. That can give that type of presentation and field of vision, what they're looking at. On the right here, this retinitis pigmentosa is a situation where you'll see here, and actually that would be wrong. That would be, retinitis pigmentosa should be there as far as that's an issue with the retina and your peripheral vision. No, that's correct. Yeah. So your peripheral vision can be affected by retinitis pigmentosa. Retinitis pigmentosa is as if you are looking through kind of like what you're seeing here with the glaucoma. It's like you're looking through some type of tube and you're not seeing the periphery. But in the case of macular degeneration, look at this one right here. It's affecting, it's blurring what's going on in your central view. It's better to see it, those of you online can see it better here as far as it blurs the central view. It's blurring, messing up the central view here with macular degeneration. Now, we have another image here. So this slide talks about the detached retina. You've probably heard of this, right? And so if someone has a detached retina as a result of some type of either it's a genetic abnormality and issues with their weakness within their retina, or actually they've had some type of head trauma and it's affected the retina. So what'll happen is that it's damaged and it's going to actually start pulling away from the inner lining of the eye, and that's a problem. So if a patient were to see all kinds of let's see, what would you say? As if they were having like lightning bolts and like kind of like flashes, light flashing and such, light flashing more better term in their vision, that could quite possibly be a detached retina, and that's a medical emergency. You need to get to a hospital in order to make sure that things don't progress and get worse. This could lead to blindness if not corrected. Nyctalopia, this is the issue of not being able to see well at night. Patients who are older, right, they're having issues with seeing in dim vision and dim light, and as it gets darker out at night. This retinitis pigmentosa, you saw that image before where it's affecting the periphery. So again, like I said, it's as if you're looking through a little tube and all you can see is what's inside of that little tube, and the periphery, you can't really see it because it affects the retina as being damaged. So you have this increase in central vision, tunnel vision, we would say. Diabetic retinopathy, I said to you that patients that are suffering from diabetes, they can have issues with bleeds within their retina and such, and within their eye, and this can affect their vision. And actually, patients can become blind if not treated and corrected. You'll see here these last couple of slides as far as treatments for eye disorder. So corneal transplants, right? These are the cornea can be transplanted. Artificial or natural cornea is stitched in place. Having a better shape to it also can improve someone's vision. Cataract surgery, actually removing the actual lens that's been cloudy, right? And they get a clear lens, and wow, what a difference it makes as far as their ability to see. LASIK surgery and such, right? So you'll see there are issues with actually cutting the cornea and reshaping the cornea so that it can better refract or bend light so that they'll be able to see clearly. That's LASIK surgery. You'll see here also there's other types of laser surgeries, again, to help correct what takes place as far as a patient's vision. And then you'll see here, as far as this is laser coagulation used to treat retinal detachment, right? So this is very important. The laser beam spot welds the retina to the underlying choroid. The choroid is that middle layer of the eye. So pretty wild that we can use these lasers in order to correct actually your ability to see or if there's issues with your retina. And that's it for the slide presentation, folks. So I'm going to stop recording.